Providing care, remembering that pets with problem behaviors often stay in the shelter for longer periods of time. So for me, providing behavioral care for treatable animals means that we always start our shelter behavior programs by creating appropriate enrichment and training programs for our shelter animals, and we'll talk about that next. But also by having creative marketing programs and outreach to find homes, as well as regular reassessment. We've talked about our daily rounds, but we also, on our dogs, repeat our behavior evaluation monthly. On cats, if we see that they've been with us for a while and they're not finding a home, we'll do an evaluation to see if we can find something that is making this cat a more challenging adoption. So as I said, start with the basics. We can save the most lives, we can do the most good in the easiest way by having a very good, strong foundation behavior and training program. So providing them with physical, social, and mental enrichment, so doggy play groups, feeding them through treat buckets, giving them Kongs, walking programs, things like that. Through basic training, training dogs not to jump on us, not to pull on leash, and through behavior protocols. And we have written protocols for our treat buckets and Say Please program, which are on our website. I'm going to escape out of here for just a second and show you a video of us using our treat buckets. So what we do is we use our treat buckets with how many of you here have treat buckets outside your kennels for dogs and use them? So great. We have treat buckets outside our kennels, as many of you probably do too, where we put dog food in. We actually put a mixture of adult dog food and puppy dog food in our treat buckets. And with a new dog to the shelter, as you're walking by the shelter, we just toss a treat to create positive associations with people. And as time goes on, we'll use them for training. So teaching the dog that they don't get the treat unless they have 4 feet on the floor, and we don't enter the cage unless they have 4 feet on the floor. So with providing care for these treatable animals, we do want to do everything, obviously, to minimize risk. And that's always a challenging issue to grapple with. We had the question earlier about how do you know what a dog will do. We don't know what a dog will do. We don't know what a cat will do. We can gain as much information as possible to attempt to predict, but I can't guarantee that my dog, my rat terrier Herbie at home, isn't going to bite me tomorrow. I think it's very unlikely because I have a long history of behavior with him where it hasn't happened before, but we can't guarantee anything with anything in life, but we can gain as much information as possible so that we're doing everything possible to reduce the risk. So obviously we want to attempt to place pets for adoption that are going to be safe in our community, and that really relies upon having good programs where we are counseling adopters about, number one, making sure they're able to manage a pet with a problem, and number two, making sure as much as possible that it's going to be successful. So matching the pet to an appropriate adopter, that's oftentimes, we'll talk about this later, but that's oftentimes the number one thing that I think that we do in our shelter to save lives of these challenging pets. And that is finding that right owner, finding that person who, to them, food aggression is not a problem at all. They're not worried about it. They're happy to have a pet with food aggression, and actually that's very common in our community. We want to be honest and realistic. We're always very honest with our adopters about what we've observed with the pets in our care. Always remembering that saving lives in our Shelter involves our shelter, but it also involves our community. I work in a community, Boston, which has a muzzle ordinance for pit bulls. So all pit bulls are required to wear muzzles in public. It's not a strictly enforced legislation, but it is there. And like many, many communities, we do have many landlords who will not take pit bulls into their buildings. When I moved to Boston 2.5 years ago with my pit bull, I'm a veterinary behaviorist. You think you'd trust me that if I'm moving with my pit bull that I'm a pretty responsible person. I had a really, really hard time finding a home with my pit bull. And so I, from firsthand experience, really, really understand when these people are surrendering their pet saying, I can't find a place to live with this dog. It's reality in my community. So involving our community, working on breed-specific legislation, but also working, if I live in a community where a dog that looks like this, and these are dogs that look like pit bulls, they're not necessarily pit bulls, but dogs that look like this are discriminated against, maybe I can send these dogs to a different community that doesn't have the same laws and they're more likely to be adopted. That's, as we all know, that's always very challenging with dogs that have that physical appearance, but certainly something to always think about. Networking. Networking is a huge part of our program. You would think I'm a veterinary behaviorist. There's another veterinary behavior specialist who works with me, Dr. Amy Martyr. You think with all these specialists, we'd never have to send a pet somewhere else. That's simply not true. We work and live in Boston. It's a very, very busy city, and it can be a very, very stressful place for some dogs. Some dogs are just completely overwhelmed by being in Boston, and they do horribly there. Or we have a dog with aggression towards other dogs, that seeing so many other dogs on a regular basis is very, very stressful to them and can be challenging to manage sometimes. So we have networks with shelters in different communities. We have networks, we have 2 other shelters ourselves, one out on the Cape, which is a lot quieter. We have networks with dog trainers in different areas and a couple dog trainers who also have adoption programs. So they'll take some of our more challenging dogs that for placement in the city and help us to place them. We also in Massachusetts have a program called the Pilot Program. Is there anybody here from Massachusetts? Oh, we have one person. Hi. We have a program called the Pilot Program where shelters in Massachusetts, if they have a dog that they're having trouble finding a home for, they can post this dog on a website, and we have a whole network of people. So we very frequently get dogs transferred to us from the Pilot Program, so shelters in other communities that are having trouble placing a dog.